All right, I'll get started as people are joining us. I'm not the prime speaker today, so if people miss my part, it's okay. My name is Corinne Waldo. I'm the Senior Director of Economic Vitality at the Boulder Chamber, and we want to thank you for joining us for kind of a reboot of these cross-industry public health updates for Boulder County. They're based on demand. I heard you. I think Lane heard you. A couple other chambers heard you. That in some cases you just need to know what's going on so you can make educated decisions around your mask policies if there's not an order, or your reopening plans, or cases, interesting situations that are coming up that we can continue to provide resources and links for information to you. So I'll continue and relaunch the weekly emails with resources and information on some of those best practices, as well as information as some of the new grants related to ARPA funding are released. So I will send that out, and that should give you additional information in addition to public health. At this time, I'm going to hand it over to Lane Drager. I did get a bunch of questions via email. Please put them in the Q&A as always, and we'll try to get to as many as we can. Thanks, Lane.
Thanks, Corinne. Thank you all for joining. Appreciate you taking time out. I'm going to do my best to give you an update of where things are at, and then some projections of what might be coming. So I want to really just make sure we can ground where public health is at and what the drivers are for actions that are being taken, and the goals and things that we want to see within our community. So, public health is the prevention of disease. And so for COVID, we are trying to prevent unnecessary deaths and significant illness, so those big hospitalization. The aim goal is not zero incidence of disease. That is very difficult to achieve, and it takes too much of a toll. But really those unnecessary deaths, and when we talk about that, we're really thinking about people can get vaccinated if you're 12 and up, barring a few instances, where there's some medical issues. So really there are a lot of ways to prevent disease right now. And then we're also going to talk about some additional mitigation strategies as we move forward, but we really want that to be the biggest piece. And the other big factor that actually is linked to that unnecessary deaths is if our healthcare system is overwhelmed, where there are more people demanding ICU beds than there are beds available, it doesn't matter the reason you needed that bed, it's no longer available. So that has always been one of the big pushes to make sure our healthcare system doesn't get avoided. And there's some other strains on that system that I'll touch on as well, beyond just COVID and other diseases that are putting that demand. And ideally have something semblance of normal activity that we can safely return to. And we do not want to see lockdowns where things are closed and people can't go into there and businesses can't be making a living. So we need to make sure we have as much semblance of normal activity with minimal invasion as possible. So we really need to make sure immunizations happen. That is our number one solution to this problem. We know that its effectiveness, even with the current Delta variant, we know what the burden of disease is based on vaccination status, and we know the outcomes. So that is really what we need to see. And then we have additional mitigation strategies that we can look at, but some are more invasive than others, and we want to start with the ones that have the least impact to, again, allow that normal life. But we definitely need to accelerate vaccinations. And one of the ongoing dialogues that we're going to work with the chamber and really throughout the metro area is having employers start to think about and look at how their staff and what their immunization policies, if they have any, or that they might consider doing that. Because again, vaccinations is our biggest solution, and it's at our fingertips. So just to give you a picture of not just what's happening in Colorado. People often say, well, I don't really care what's happening in other parts of the country. This is a global pandemic. This disease moves around as people move around. So it is important to know what's happening everywhere. But the Delta variant has accelerated what's happening with this disease. So this is even a little dated because it was August 9th. But in 1 month, we just saw this acceleration to pretty much high transmission across the country, and certainly within Colorado. So we're really looking at what is happening with this disease and why we need to take additional mitigation strategies. So Colorado, what's going on here? So obviously it's even more important to see what's happening with our neighbors because we are still very mobile within our own state. But we're seeing, again, really big increases from where we were. You know, when we were able to step out of all the public health orders and get to clear, we were way lower than this. We were not seeing anywhere near this level of cases, and we've climbed back up. And I think because of some of the proactive efforts, we're still staying a little bit below some of our peers in Boulder County, but this has changed since I, put this slide deck in place. So we're seeing that change where we're now in the high level of transmission rate, based on the CDC's tracking of kind of cases per 100,000. So this is why we're having some of these discussions and why we are going to continue to look at some of the needed steps to continue to protect our community. So as we look at the CDC buckets for levels of transmission, low, moderate, substantial, and high, we were really in that low and moderate when we were able to step out of things. We were seeing much lower case incidence rates than what we're seeing now. And we're again continuing to see that climb kind of week after week. We're continuing to have an increase. So it's definitely at a place where we need to have some additional mitigation strategies. So this one's super busy, but you can kind of see as we got into the summer, really we were not seeing a lot of cases really across all our different age demographics, but that has really blown up July into August. And what I want to point out, it's kind of hard to see all this bottom slide of age groups. We've heard people say, well, kids don't get sick, they don't get COVID. They do, and actually some of the trends for rising case counts are highest among children and some of the school age kids because school is now back in session, so that's going to be another driver as well. But there was just a lot of activity over the summer, and kids definitely can get COVID. They always could, but the Delta variant has increased. What we're seeing compared to last summer and this summer, we're seeing a big difference in cases among children. So that first goal of preventing unnecessary deaths and significant illness. So we really want to make sure we're addressing this current Delta variant because the evolution of this virus is going to continue if we don't really see it kind of start to move to a much lower level. It will continue to mutate and will continue to have potential for either more breakthrough or more severity of disease. But what we're seeing on the Delta variant is certainly more people getting sick, more breakthrough even for vaccinated folks, more impact to youth, more hospitalizations, and that's really been the trend across not just our county, not across the metro area, but across the country. So that's why it's so important to really get back to that vaccination piece because this is a disease that we have a prevention for. So we really need to look at that. And then these 4,000 cases with 37 deaths, that's not COVID, that's specifically looking at additional nuances that are evolving from that. So there are more cases than that, but this is looking at specific youth impacts. So again, I've kind of mentioned this, but we're really concerned because our case counts are still going up. We're seeing breakthroughs. We're still seeing the majority of our issues among the unvaccinated population, but we're really seeing all those layers of impact, more people getting it, more hospitalizations, and then sadly more deaths. So we really need to look at what's happening in our community and what strategies we can take to still come back to that place of some semblance of a normal life. This is just a trend showing you the metro area. You don't need to necessarily see all the colors, but you can see when we had our massive outbreak last fall in 2020, then we had the surge, kind of early on. And then now here we are again on this really steep climb in 2021. So again, we need to make sure that trend at least levels off, if not, hopefully goes back down. Again, hospitalizations have a mirror graph as well, where those are again continuing to have that climb, just like the case counts are. So this one again about the healthcare system, I mentioned, there's sort of a dual competing issue of why the system is being strained. One certainly is the demand, how many people need ICU beds for all the various illness, not just COVID. But the other big strain is staffing. So the healthcare system is not seeing robust staffing. If you can imagine being in that world and working a year and a half on COVID and still being in that place, not to mention all the other diseases people treat, there's just a level of burnout and ability to actually continue to have adequate staffing. So we're very concerned about that, not just for rising hospitalizations because of COVID and other diseases, but again, that capacity of the healthcare system, not just straight how many beds they have. So currently we've seen about 60 to 87% of the capacity is being used up in the Boulder County system. We're also seeing strains come in, or strain to the system coming, because out of state systems are starting to feel even more pressure in sending patients into Colorado, which again is why it's so important to see what's happening, not just locally, regionally, but even at a national level, because the healthcare system is connected on a much broader level. So what is happening in other areas can have an impact on our healthcare system, because patients may even be sent here for surges. And then I think the one that's probably definitely on the mind of our business community, as is on our mind, is how do we still have these normal activities and not get into shutdowns, limits, and all the level of public health orders that were happening across the state last year. So again, when we're in those high transmission level like we are now, we need to add additional mitigation strategies to try to come out of it. We know our case counts are actually much higher than where they were, and being undercounted. We know people aren't always going in for treatment and being diagnosed. So the hospitalizations certainly are one evidence piece that's increasing, but we know there's additional cases out there that just aren't being identified. And that's always been the case, and is really the case of almost every disease. And I think that important piece, there's been a lot of numbers shown about vaccination. And if you actually look at our population and how many people are fully vaccinated, we're at about 66.3%. So some of the stats have shown, when you bring out the folks that are not able to be vaccinated, what is the percentage, and it makes that number look much higher. But we need to look at our whole population and see who is unvaccinated, because that still presents the overall risk and whether we're close to a herd immunity or not. So we're still at a lower level than we need to be to not have additional mitigation strategies. We know we have a lot of children who aren't eligible yet, as well as there's some immunocompromised people who, even when vaccinated, don't get the same immune response. So we know that there's still a concern in our community about how many people are potentially able to get COVID. We also know that with the return to school and more offices opening up, and really over the summer, a lot of things going back to some semblance of normalcy, there's been a lot more opportunity for spread of disease. And obviously that's what we're seeing in the numbers. But we're also preparing for what may happen this fall and winter as activities move more indoors, and our risk further increases when we don't have as much availability for outdoor activities where the risk is lower. So we really want to touch on, I've talked about breakthrough cases, and that's a big concern, but we know the bulk of what's happening is in the unvaccinated population. So yes, we're seeing just under 20% of the cases could be breakthrough for people that are vaccinated, but 80% plus are unvaccinated people. And then the big piece is the severity. So people that are getting sick enough that need hospitalization, and sadly the folks that may have passed away, those are overwhelmingly unvaccinated folks. So again, the value of the vaccine is, there's no doubt in it. It is the big solution to not only the severity of the disease, but really how much this disease is able to spread in our community. But it isn't in of itself the only solution, because we know there's still a capacity for people to have breakthrough cases. We know that that people can actually still spread COVID even when they are vaccinated. So it doesn't make your body immune to doing that. So we need layered mitigation strategies, not just vaccination. So as we think about that, thinking of a spectrum of things that can be done and employed, even beyond whatever is even being required of you, because that may be some of the questions that I get are, do we have to do this? Do we have to do that? And even if there's not a public health order saying you must do it, many of these strategies will help prevent disease, within your business, and prevent that spread, prevent potentially your business having an outbreak. So there's a lot of things that you should do, even if they're not required. But again, we don't want to get down to this far end where we're back to doing lots of reactive things because there's too much disease. And that's when we talk about quarantines and isolation, that's a reactive because people got sick and they exposed others. Now we have to take much more burdensome strategies. And then even further is thinking about lockdowns and all the restrictions that were put on businesses. Those are incredibly burdensome and they're very reactive because the disease has gotten further and further out of control, versus staying on the proactive side of getting vaccinated, screening your employees, having really good illness policies, doing testing where you can, doing all of those kind of components that are really going to help prevent disease spread. And masking is another big piece in that hygiene, in addition, like hand washing and things like that. This is kind of just to give a more visual of each strategy has some level of effectiveness. And as you layer these, you get less and less holes for, to have risk of disease. And I think that's kind of what we want to talk about now, of not just having vaccine as the one standalone. We need to have some additional strategies that we put in place. So this, again, just to maybe dispel the myth that if you're vaccinated, there's 100% immunity and you can't spread the disease. So people can still get the virus. They may not become ill, or they may have a much lower overall illness than the severity of people who are unvaccinated, but they can then still spread the virus. So by having both vaccinated and unvaccinated people masked, we are adding another layer that's going to minimize that potential exposure. And so this is kind of just illustrating that if you are able to mask both vaccinated and unvaccinated people, you are helping reduce that overall transmission of the droplets, between the two folks, and then further preventing the spread of disease. So I want to talk about the timeline. So today we're sharing with you at least what's happening with COVID, talking about then some of the next steps of what we think is going to be happening. I know on Monday our Board of Health will be meeting. One of the main topic there is, should they put an additional public health order in place that would require indoor masking? So if you're not aware, the Board of Health already has passed a public health order addressing schools, childcare, any kind of child activity setting. They do require masks in those instances. And now it's going to look to expand that to all indoor settings. And again, potentially regardless of vaccination status. I've kind of made a big push to give us a week or so that after they pass that, to get all of the businesses ready for what's coming. You can see exactly what the order says. Corinne has already scheduled a webinar next week. So that would give us an opportunity to come back to you and tell you exactly what was passed. You'll be able to get whatever signs you need and think about your implementation. So I'm hopeful that it won't necessarily go into effect if they pass it immediately, that there might be some implementation, but I don't know exactly what will happen with that. There's some concerns about giving a delay too. So there's a lot of weighing there of what could happen. The other kind of piece is really, are there additional nuances, maybe even exceptions that are put into that order that can be explored, really that can promote vaccination as an alternative to everyone having to mask? If you can get assurance that the entire group is vaccinated, can there be some concessions there? And then the duration of it is really going to be kind of based on what we're seeing in our community. When we're in these high levels of transmission, we're going to need these strategies. So they will definitely stay in place whenever we're there. And then kind of figuring out what are the triggers to sort of back off of this. And there's pluses and minuses to moving back and forth. It's difficult for people to know where we at. And then when you're actually more used to something and then you change behavior, there's resistance to move backwards. So we're going to help define what that looks like. But when I showed those buckets of the CDC transmission level. When we're in those high levels, we're going to need mitigation strategies like this. So I do expect the public health order to stay in place and have some language that talks about what level of transmission we're in, as well as looking at what is our community vaccination rate. So that does play a role in, are we at a level of herd immunity? And that community probably is going to go even beyond Boulder County, because we know we have folks that live in one county, work in another county, they have kids in a county. So that regional impact is still very relevant to what we're seeing. We continue to work on our communication. We're working, this is some of the stuff we're doing with chambers, but areas of focus is those vaccination efforts and really promoting policy. So that's going to be, I think, one of our big ongoing efforts is hosting a webinar here in the near future. That's probably a regional effort, so that businesses can hear, ask questions, and understand what does it look like, or what does it take to implement a vaccination policy for your business. And we hope that the public health order maybe even gives some something that's incentivizing you to do that, that maybe it would be a way for you to move out of requiring masks. But that's still a nuance that has to be discussed and decided at the Board of Health. But regardless of whether it gives you out for a mask, it's an important strategy for your business to stay viable, stay open, and really help give that public assurance that you have vaccinated folks and that you're requiring folks to come and also be vaccinated. You know, those are just different nuances for you to look at and consider. And then we will have to look at enforcement. If people really are egregiously violating that, we had very few of those over the last year, but we are concerned, you know, that we have, you know, some facilities that just are going to refuse to follow these things, and it will unfortunately lead to some enforcement level. So with that, I'm going to end this, Corinne, and stop sharing here. And
don't worry, we have plenty of questions for you. So
take some.
You're good to go. All right. So I think the big question, I think you startled some people at the very end of the webinar with the item that the Board of Health would be hearing a potential indoor mask order on Monday. So I think, you know, just to restate it, would be that if the Board of Health approves, we don't know what the order looks like, approves an order on Monday, there's the potential that all facilities indoor would need to require masks regardless of vaccination status is ideally what that would look like. Now, what the nuances are about eating and drinking and swimming and working, you know, all that stuff is still being worked out. But right now there is the potential indoor mask order. And that's why we have a webinar next week, is that once we do see the order, we can help navigate through it.
Yeah, so that's, oops, is that my video?
Yep, you're on.
Okay, it sounds really garbled on my end.
You sound great to me.
Okay, and I don't know how to stop sharing that screen. I don't see the buttons on they're disappeared on my screen for functionality, so I don't know what happened with all those. But yeah, that is definitely what the board is going to be considering. So so one opportunity for me today is to get some of those issues and concerns. There we go. Now I see it. Oh, it says I'm not sure. Okay. So definitely want to hear what the concerns are. What are the logistic, you know, barriers to some of those pieces? What are the tools that are needed to be successful, so that I can feed that in prior to the board, you know, convening to talk about that.
Okay. So that answers quite a few questions, because we had questions before saying, you know, a lot of businesses are requiring masks, or they're only requiring masks of their employees, or they're only requiring for unvaccinated. And it's so different across the county. Will there be a state or local order? And the answer is most likely there will be an indoor order. Now, are they talking about any sort of outdoor order, or, you know, any language about unless 6 feet can be maintained, or is outdoor not even being discussed right now?
I think it has been discussed as far as, are there certain situations where there's large outdoor gatherings, you know, like a major concert where people are being packed in. But I don't know if that will be anything that makes it into the order. But I think, you know, there can be outdoor settings that are still risky. just being outside alone doesn't eliminate the risk. It's that close proximity of folks, especially without being masked. But at this time, I think the main focus is a uniform application. So I know, there's even a whole host of signs that the chambers provided folks, depending on what their comfort level is. So this would consolidate that and really drive that you need a single sign if the order is passed that says everybody has to wear a mask, not based on vaccination status, not just if to your comfort level. It would make it uniform, unless there's an exemption, and that will be very specified and called out of what it takes to move down that exemption route. And it would likely be that, everybody's vaccinated. That would be the situation. And then there still could be some mitigation strategies that are needed based on the activities that are going to take place.
Well, thank you for mentioning that. So in that masking toolkit that I sent out, there are, I think, 8 signs, and they're in English and Spanish. And we already have the masks are required regardless of vaccination status. We also have my staff is fully vaccinated. My staff's wearing a mask to protect you. And then we have the other options, because right now the requirement is only for certain facilities, but you have the option as a business to require masks. And I've seen it all over town. I'm now going all over town. I see masks, and even we put up the highly recommended. And if somebody's wearing a mask, we're finding that most people are wearing the mask in the facility when it's highly recommended, but it's moving to that required. I do want to publicly thank Downtown Business Partnership, City of Boulder, and Latino Chamber for collaborating and getting that signage out so quickly. It is available and it will continue to be available if we need new ones, but I'm pretty sure we're covering quite a few cases in that area. And we have a no logo one, so it can be used throughout the county.
And there's those other signs, like all of your staff are vaccinated. Those would be signs that you could still use and supplement, because it wouldn't be anything that's less stringent, and hopefully it adds some assurance, or you're wearing masks also to protect your customers. So that's just a good informational PR sign. But the ones that might, if the order passes, would no longer be okay is, it's up to you as a customer based on your vaccination status. If you want to wear a mask, those would not be okay signs to continue once a public health order goes in place.
And I'd separate the required one out and just send that one out as well. And then the state also continues to have the weird blue shaped ones with the masks are required that they put out in a toolkit for the vaccination toolkit. Now, do you think there's going to be a difference between public facing and not public facing businesses on masking, or is that just going to be,
I don't think so. Yeah, I don't think so. So we're not necessarily just looking at the risk a business has between the staff and the patrons. It's really looking at inside the business too. So as I mentioned, people that are vaccinated can still get the virus and give that to other folks, even if they are asymptomatic or, don't become ill. So there's still a risk of transmission indoors between anybody. So again, people that are on your workforce in an office building, there's still a risk of transmission within your office, even if you don't work with outside customers. So this is really looking at that burden of disease across our entire county, and how do we further add a layer to minimize what's happening.
And then we're getting the questions again now, again, specifying vaccinated or unvaccinated, most likely it'll be regardless of your vaccination status indoors. And then we're getting the questions again about what if you're just sitting at your desk? Would you take off your mask type of things?
It will call out all those kind of situations. If you're in a pool and you're swimming, if you're a speaker and you're able to be this far away from the group that you're speaking to, what are all those conditions where a mask, wouldn't have to happen. But, just in general, all indoor settings will need it. And then they'll call out, here are those situations, much like the previous orders. Here's some of those nuances where, if you're alone in a building, in your office, closed door, can you take your mask off? So it'll answer all those questions.
And the question is, are we sure there's going to be a mask order on Monday? And you're saying it's going to the Board of Health, but we're not sure what they're going to vote. And those are public meetings. So the Board of Health meeting is a public meeting, and it's on the Boulder County Public Health site to get the link to that. But also, we're not sure the implementation date, if it'll go effective at midnight on Monday, if it's passed, or if they're going to give it an implementation time. And that's what you've asked for as an implementation time, but we're not sure about that at this time.
Yeah, none of it's guaranteed, but I felt this is really important to meet with everyone because I think it's likely. I mean, so again, you decide what your betting odds are, but I do think the board will probably pass a public health order. How much of what nuance is in there, when it will go into effect, what all the final language is, I don't have as much confidence, but I think it'll be very close to the final drafts that are prepared, which hopefully will be ready very soon. But I think a lot of the nuances that I'm sharing, those will be a lot of those topics that I think, there will be things called out, those nuances where a mask, can be removed for certain settings. But I think they will. But I don't know. They still have to decide and vote.
And I think a group on here that has all along had concerns about masking are the fitness users. If we can provide the distancing, if we could masks be taken off, or could there be alternatives for individuals, especially as we're entering the winter months and there's less outdoor fitness options. And then the swimming, indoor tennis, some of those that came up a lot before. Are there situations where if you're able to maintain distancing, could masks be taken off in certain situations? So
Yeah.
Just putting that out there for you to capture what people are saying across the board.
Yeah, and I can answer the swimming now because we already have a mask order that's related to, children activities, schools, childcare. So swimming lessons, kids being in a pool, you've never had to wear a mask when you're in the pool in any of the public health orders and mask orders that were required. So
what about the instructor? The question comes back to, can you have an instructor in there with the pool under 12, under the masking order?
Yeah, so that will hopefully get answered when the board meets to look at that. And I'm hopeful that there is a provision, for not just gyms but any setting where if you are able to ensure vaccination rates and have other mitigation strategies, can masks be removed? So I'm hopeful that we have some kind of program that can be reviewed and approved that would give some of those exemptions, but that still needs to be weighed and decided by the board.
I'm taking names for a program like that, not 5-star, please, no more 5-star names. So this is the Boulder Public Health Board, not the State Board of Health. This is the
Boulder County. Yep.
Okay, then can you define youth? So even under the current mask order, there's some questions about what youth is included in the childcare camps, even those places that are cross facilities that have workout areas, and then youth camps or youth childcare settings. What is the definition of youth and ages?
Yeah, it's basically 2 and up. So so this goes down to 2 years old.
So 2 to 18?
I have to look at that to see if it is including kind of some of the vaccinated ages, but I believe it's any for the school age kids, it would go all the way up to high school. So
I think on the Q&A site, and I've sent this to a couple of you that are actually on the webinar, we got them to clarify on the Q&A site those mixed facilities and what is defined in youth in those facilities. And I believe it goes from 2 to, you'll have to look. It depends on the facility, but in the school and the childcare, all that was the full K through 12 or pre-K through 12 setting. Okay. Can a swim instructor physically support a child in the water in an indoor age 12 and under? That's that question again, but right now, because you have a mask order right now for youth, can a swimming instructor physically support a child in the water?
You mean, can they actually hold them, whether they're in a mask or not? I don't have an answer to that. I think they can. I think that's more a safety issue versus a parent doing it.
Yes.
So yeah, I think that hasn't changed from where it was. So, but I'll have to make sure and validate that with our attorneys.
Okay, so this is Matt. You showed that spectrum, and I think that spectrum is a valuable tool to look at. These are the least restrictive. These are some of the things we can do to try to not move us down the spectrum to more restrictive. But are there talks of capacity restrictions in the fall or heading into the winter? Again, planning cycles for businesses are a little bit longer, and so understanding what's being talked about is good.
Yeah, I mean, I haven't heard of anything, but I mean, those are part of the strategies that were used last year, and they have a level of effectiveness. They also have a level of impact and repercussions and secondary impacts. So, we are very aware of that, but I haven't heard of any talk about restrictions other than looking. There could be some potential of having masking in, again, outdoor settings where there's really going to be large, tight crowds. So again, you're going to pack people into a stadium to watch football where everybody's shoulder to shoulder. Maybe that if you aren't going to provide social distancing, maybe you have to add masking. So I haven't heard of that, for sure going into this order, but I think those are our discussions. Again, if our case trends continue in the wrong direction, we're going to need additional strategies like that, and try to also pin it back to, can we figure out which types of events and activities are contributing most to the disease, which is challenging because people often have a whole host of things they've done, and trying to figure out where they might have gotten COVID is very difficult.
Which leads me to a question. I got a couple phone calls yesterday about this particular one. Should you be doing symptom checking on your employees now and into the future?
I mean, that's a great preventative step to catch things, because you really don't want sick employees at work with any kind of contagious disease, even if it's not COVID. So having strong illness policies and ideally having people not show up to work sick so you don't have to screen them is the best. But if for some reason you have a lot of people that still come to work sick, identifying that is very valuable so that you aren't in an outbreak situation or where you're potentially closing your entire business down because multiple people are ill and you're kind of the source of that outbreak.
So this might be a good time for our businesses to re-emphasize policies about not coming in when sick, their sick leave policies, leave for vaccinations, those types of things now, especially as we head into flu season, it's allergy season, we have colds going around, a lot of different, it might be a good time to re-implement some of the reminders that we had early on. And it's about, when you're sick, stay home. We were talking about this beforehand.
Those are just good policies outside of COVID. They were important and valuable tools before COVID, and many businesses have different illness policies on not coming to work when you're ill, ideally giving people, paid leave so that they can afford to stay home. Because that's a real dilemma if people have to make choices between an income and a livelihood versus following policies. So,
well, and if they come to work sick and other people see them sick, they might start to fear their, whether they've been exposed to something, and then you got this whole testing situation. I know I've talked to a couple of businesses that are in a little bit of, chaos because they felt like employees did feel like they were exposed to others that were sick and weren't sure if they were exposed to COVID. So it's also employee retention and safety in a lot of ways. Okay. Yeah. So I'm going to ask, so just a clarification questions, and we're going to go back to a different topic. Actually, really quickly, will you talk about how masks would impact restaurants most likely? Would it be when eating and drinking, they wouldn't have to wear a mask inside?
Yeah, I envision it being very similar to the mask orders we had previously. So all the different nuances where we kind of finished up, that's kind of where we would be going back to. So, the various conditions where you didn't have to wear a mask would still be in this order, but all other times, when you're entering and leaving and walking around, you would need masks, but not.
So going to the bathroom. So when you're not eating and drinking, do you think there will be a restriction on people from different households at this time, or is it just right now masking?
I think this is very focused on indoor masking.
And right now there is no talk of distance requirements, the distance, the capacity limits, moving tables farther apart. We're talking really about just re-implementing an indoor masking. Again, that spectrum, trying to implement some of the early vaccinations, stay home if you're sick, wash your hands, do extra cleaning, and wear masks indoors. That other stuff, the capacity restrictions, closures, and some of those are later down the spectrum if we can't control numbers with these earlier items. All right, so we just keep getting more questions out. Okay, so now so the NAAT metric that you gave is pretty similar to the percent positivity rate that we've always been tracking. And in the chat was the definition, the nucleic acid amplification test is the viral diagnostic test for COVID. So it's very similar to the percent positivity. People were just asking what that meant. So I wanted to get that on video because we have people watching this on tape recording later on. So let's talk about statistics a little bit. Healthcare system. There's been an ongoing concern about overwhelming our healthcare facilities. Has there, over the past year, have they been working on increasing capacity in order to better respond to increase in transmissions, or what's been the work in the hospital field to help prevent this?
I think they're seeing the opposite. I think they're seeing an even bigger strain on having capacity than that they've been able to build up an even more robust system. I think there's just been a lot of loss in folks, that this is a very difficult occupation to weather this storm. It's been hard on everyone, not to pick out that this is the only sector that it's been hard to deal with COVID, but folks that have really been in the trenches, seeing ill people and dealing with it and having their own exposures for a year and a half, that takes a toll. And so I think there's a real demand versus a robust work supply.
Okay, that goes now, we all hear and look at the hospital numbers, and there's a lot of questions about, I don't see many hospitalizations when you do the daily reports, and are our hospitalization numbers really that bad? And what are we really worried about in our hospitalization that's leading us to this policy change? Even looking at the ICU beds, it might be one hospital that's under pressure, but some of the other ones are not. What are some of the things that may not be public facing that they're talking about within the hospital systems that we're talking about this capacity limits?
Yeah. So I think I mentioned this previously, is ICU beds. There's only so many ICU beds. If you had a stroke, you have a heart attack, you have a severe COVID illness, there's only so many beds for all of those various diseases. So it isn't just that there's this many beds for COVID. They're all available for whatever is needed. When those are exhausted, there are no more beds. And then you're in a crisis standard of care, and you have to decide who gets care and who does not. And things that are treatable and people could recover from, without an ICU bed, you don't get treated and you don't recover. So we start to see, morbidity, mortality across every disease, not just COVID. So that number of hospitalizations that are being added for COVID isn't the full burden of what's happening in a healthcare system, of why people might be at the hospital. So it's important to know that when that capacity is exhausted, it's exhausted. So that doesn't matter what your illness is, you won't be able to get a bed. So we can't get to that point. And
then there's also, because the numbers, I heard this on another webinar, and a couple of us made the request for this data, because there are an increase in the number of youth cases. There are actually the number of ICU beds for youth are a lot less. And if those numbers start to go up for hospitalization among youth, then there are very limited capacity in youth ICU beds too, correct?
I don't know what the numbers are for that, but typically there is not as much demand for youth as there is for adults. So I would expect there probably are fewer overall youth capacity.
Because right now the tracker on the website just talks about adult ICU, and I think if they're able to generate a data point around youth ICU beds and capacities and show that a little bit more, that might help some of the conversations that are happening around. So I'm looking at these data questions again. Do you think a mask order will incentivize people from getting vaccinated?
We certainly hope not, because vaccination is still the #1 solution we have available. That's why I do hope there's some incentives built in there that if you have a fully vaccinated, say, office space, potentially that would allow you as an office to take off your masks and then just practice more social distancing and hand washing, but you can kind of move about and operate more without masks, and other settings where you can kind of establish those, 100% vaccination rates. Because masking is not a better solution than vaccination. So for people who want to put their stock and say, well, I'll just wear a mask instead of get a vaccine, the vaccination is incredibly effective. Masks are going to reduce it, but it doesn't protect you anywhere near the level of a vaccine does. So we need combinations, not just masking. We definitely still need vaccinations.
So speaking of vaccinations, you mentioned the potential of business owners mandating and requiring vaccinations, and I'll talk a little bit about the vaccinations webinar in a minute. For employees, what is the medical healthcare company's position in mandating vaccines? I know BCH came out, Boulder Community Health came out, UC Health, a bunch of the hospital systems are mandating vaccines by a certain date. The state of Colorado is mandating it, and a few others. They're giving people time to get their vaccines, and that's kind of what's happening. But what is their general position on mandating vaccines?
I know there's a number of groups that have come out, in support of that. And I have a slide somewhere else. I was going to see if I could pull it up that shows at least kind of regionally how many folks have already kind of implemented various vaccination policies. Boulder County Public Health is already in the process of doing that, as is Boulder County. University of Colorado, all of its campuses, not just faculty, but the students must be vaccinated. So there's a lot of different entities that have kind of already moved down that path. I know that there's even local businesses that are asking their patrons to be vaccinated in order to kind of be indoors. So there are a number of folks that have already proactively gone down this road, and we want to just help provide a forum, because I think a lot of people think, well, I can't legally put policies like that in place, and you can. And so that's, I think, the support is to give the various policies that, can be shared so people can see sample policies. How do you think about doing this? What it does and doesn't do, because there's a lot of, I think, misinformation about, you can't do this, it violates HIPAA laws, it does all sorts of things, and it doesn't. You can do these types of things.
So our plan, our strategy is to take this session in 2 weeks and make it about vaccinations, vaccination policies, potentially have a legal expert on, and talk maybe about vaccination incentives if you're not willing to mandate, but are there incentives that are working for businesses to get people vaccinated, whether they're community-wide incentives or business-wide incentives. So I think that's our plan, is not next week, since we know next week we might have to talk about a masking order, but the following week is to do it mostly about vaccinations and vaccination policies. Okay, so there's some questions about, have we increased our ICU beds from 2019 to 2021? I'm not sure you can answer that. We could look into the numbers, but are you able to answer that?
The capacity?
Yeah.
I don't know what the numbers were 2019 to 2020, so I don't have an answer for that.
Okay, have there been talk about, has there been talk about the Lambda variant?
Yeah, I think all variants are being tracked. From what I have heard, almost entirely the cases that are being diagnosed right now are Delta variant, in at least locally and pretty much regionally. But yes, I think all variants are always being tracked to see what the prevalence is, what are we seeing as far as severity? Are we seeing more and more folks ill, hospitalized, dying from different variants, again, breakthrough cases. So all that stuff is being watched, but Delta variant is what by far is, that's what we're seeing, right now, really throughout the country.
And they're monitoring Lambda variant for later on in the fall and the winter, potentially.
Yeah, just monitoring anything. It's always important to see what is the most prevalent, as well as, what's causing the most severity, what's causing the most breakthrough. All those are all parts of tracking. And that's why you're trying to get variant typing. It's not just that, somebody's been identified with COVID, trying to see exactly what they have.
You encourage people to continue to get tested, correct? If you have any symptoms, get tested. And we
Yeah.
have a lot of testing resources out there, some rapid, the ones that are at Stasio, that ends sometime in September. Then there's a Longmont and Netherland, there's those facilities. You want people to get tested if they're sick, correct?
Yeah, definitely. I think all the same protocols that we've talked really throughout the entire pandemic. When you're ill, definitely stay home, stay away from other folks, try to identify what is causing your illness, and then definitely isolate. And then folks that have been exposed to somebody that's ill really should quarantine. So we need all those same steps. Those are all prevention steps that help, make sure we're not seeing this continue to ripple through the community.
If you get tested at Stasi or one of the state testing sites, the ones that go to the state lab, do they tell you which variant you get?
I know that I think it's the Mako sites are the ones that are doing variant typing. I know not necessarily every testing site is doing that, but I believe all the Mako sites are.
And Stasio is a Mako site, and then the Longmont site is a Mako site. So those two are Mako sites, I believe.
And there's some other regional ones too for folks that may live, just outside the county or have access to other sites. So, but regardless, it's still important to be tested. So knowing that you have COVID and that you're going to take the precautions not to spread it.
Okay. So someone responded, yes, vaccine incentives are working really well. So just thought I'd share that. So back to the quarantine and isolation and those types of questions are coming up again. Just a reminder, if someone has been exposed to the virus, do they have to quarantine?
So it would be isolate. If you mean exposed. So you're not positive test.
Not positive yet.
Yeah, you should. So those are all still steps. And ideally, there's been a case investigation and it's identifying folks, but as we see these continued increase in trends, we're starting to surpass our capacity again to do all of those case contact tracing work. But yes, if you are an exposure to a known case, you should quarantine.
Okay, can you start sharing your screen again? I have 2 slides I need you to bring back up. While you're doing that, isolation is for someone that has a positive test. So if you're positive, whether you're vaccinated or not, you're positive with COVID, you need to go into isolation, correct?
Yes.
So as you know, we have some employers on here. They have staff, they have customers, they might have members. If they were to hear about a positive case, who do they have to inform? Let's take the staff out of this. We know about the staff piece, but let's say they're a gym and they know, one of the people says, I came in and I was positive. Do they need to inform other people that were in there at that time?
Ideally, they're working with somebody that's working on that and can help identify who are the other close contacts. So
Jim is not, it's the person who tested positive, right?
Right.
Okay.
Yeah, no, I'm saying public health would be trying to identify close contacts. So how you can help is working with public health to help identify, here are all the people. At a gym, you would need to be in close contact for 15 minutes. So if equipment is not spread out and 2 people are right next to each other running on a treadmill for a half an hour and breathing really hard, that's an exposure. So helping to identify that, but I don't know how easy that is to know who was on what piece of equipment. It's easier to think about, say a basketball game. Well, who was playing, who was on each team, and now who the close contacts are. But yeah, some of the other settings, you're not required to keep records to that level of detail, but it wouldn't hurt to be able to say, yeah, we have a roster of everybody who came in while that person was there, when they checked in or whatever. So we could do an email to this group saying, just so you know, there was, a COVID exposure, somebody that was sick and symptomatic, which is another reason for gyms and others to be asking those questions. Hey, if you have a fever and have these kind of symptoms, we don't want you to come in and work out today. So really doing some of those proactive steps so you don't suddenly become a spreader event.
So really, we're finishing up on time here. Will you show the CDC slide? The CDC slide showing the metrics. And then actually, I want you to go back one. I want you to go back to the United States map. So but somebody wants to look at the United States map one more time. And then, you know, the transmission from 1 month to the next month and going from low to high. Now, you guys are using CDC stats now. We're kind of moving away from some of those CDPHE and you're using these CDC low, moderate, and high transmission stats, correct?
Correct. And I mean, it's tracking very similar information. So it's those case counts per 100,000. It's also looking at some of that positivity. I think this is the one you wanted to see, you know, the percent of the tests that are positive. So it isn't something radically different than what was being tracked before. These are, you know, the same kind of information that we were looking at. When you think about some of those, you know, how the state created their different dial components, it was still looking at a lot of these same components.
So will you go to the hospitalization slide that shows that it's going to be peaking, but peaking in the winter months, and explain why the modeling says that?
Why the modeling?
Well, it says there was a slide that showed hospitalizations are expected to peak in December. Will you explain that?
Oh, just, you know, that's, you know, respiratory disease tends to peak, you know, in the fall. So that's, you know, following all the various illnesses that could trigger that. So when we look at flu, which is now, you know, been seasonal for so long, that's when we see a lot of peaks of those respiratory hospitalizations. So we are expecting that will follow, you know, similar trends to what we've seen in the past. So, but there's not this isn't a projecting out. This is kind of dropping off where we're at. But yeah, we don't know what it's going to look like exactly. But I think the expectation is things will increase in the fall. It's just a factor of people being indoors more than they are outdoors. You know, as that trend happens seasonally, more and more transmissible communicable diseases are transmitted.
Okay, so just real quickly, a couple more clarifications on stats and a couple more questions. We've seen that the percent vaccinated seems to be lower than it was over the summer, and you clarified that you may be seeing this number of 80% vaccinated, but that was of the qualified population.
Eligible.
Yeah,
if you take out all the kids who aren't old enough to get vaccinated, you take out folks that are, you know, unable to get vaccinated medically, or maybe even people that have, you know, other exemptions why they aren't going to get vaccinated. Those are still people who are unvaccinated in our community. So I'm showing you the actual number of our community that's vaccinated. So that still means a third of our community is not vaccinated, and, you know, they still live in our community. So whether they're not able to, not eligible, they still are unvaccinated. So that's where it is important to look at those numbers. I think, you know, there was a push to really get excited about how many people were getting vaccinated. And so the numbers were shown, you know, of the eligible groups, here's how many people have already taken it up. And it really should have been showing both. You know, yes, we're seeing good uptake in these various age demographics, other age demographics that need more push, but we still have chunks of our community that are definitely not vaccinated. And that's the raw number of what it looks like.
And if people want to track numbers, I'll next week's email or this week's email with the recording to this, I'll send links to the stats tracking, including the CDC stats tracking, the two metrics that you showed in here. People were looking at some of the CDPHE stats still, which are very similar, but track what you're tracking. The site that shows you the hospitalizations and the vaccinations by county, so that you can see the surrounding counties as well. So that should answer about 5 of the questions that are in here. Just a couple clarification questions. Do you recommend things like saunas stay open because of poor circulation, or does the heat take care of that?
I guess it would depend on how it's being used. So if there's multiple individuals, you know, from different households, those are going to be indoor exposure risks. So right now there's not a prohibition on those, but yes, as a precautionary, how those are being used, who's going in them. Those could be elevated risks if you're allowing a lot of people to pack into a small space. Certainly the virus is not going to live a long time in a hot environment outside of hosts, but it's that immediate transfer between the people in the same breathing zone that's the concern.
And just, we're gonna finish up by people wanting to use the room I'm in right
Sure.
now. We have some questions about what will breweries and tap rooms and restaurants and why restaurants and not others. Until you see that order, you don't know what's going to be allowed and not allowed and when masks are going to be required. So we're going to save some of those questions to seeing that order, but we've captured all of the feedback for Lane to take forward to the lawyers and to the Board of Health. The last thing I'm going to mention, and we can next week also talk about booster shots. I know Boulder County is calling those additional shots. Right now, they're anybody that's immunocompromised. There's a list of that. The Boulder County Public Health site lists the providers can get that additional shot of Moderna and Pfizer. And then starting September 20th, the state has said that then it's 8 months after your last shot. So I will send out that information as well about that. This right now is going to be a weekly call for the next 2 weeks. Next week, it's going to be about whatever the order is. If there's an order, if not, we'll continue to answer more questions, but we will have it next Thursday at 1. The following week will most likely be about vaccinations and then answering questions as they come up. And that's September 9th. That'll be at 12:30. I will send out the links. After that, we'll probably keep a regular cadence. We're just not sure if it's 2 weeks, 3 weeks, 1 week, depending on the need. With that, I'm going to capture the questions that haven't been answered. If you ask me to put you back on the list, then I will put you back on the list. I don't know how you came off. Thank everybody for attending. Hopefully you got some information today that you needed to go back to your staff and to leadership and to your company to make decisions. We'll see everybody next week. Thank you, Lane.
Thanks.